Hello and welcome. Today, we're diving into a common, yet often misunderstood, condition affecting the male reproductive system, the spermatocele. Join us as we explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Knowledge is power, and understanding conditions like this can help you take proactive steps towards your health. The exact cause of spermatocele is often elusive, and in many cases it remains unknown. However, several factors are thought to contribute. One possibility is a blockage in one of the ducts within the epididymis, the coiled tube located behind the testicle where sperm matures and is stored. Trauma or inflammation in the epididymis can also be implicated. In some instances, spermatoceles may arise spontaneously without any identifiable cause. Let's break down what happens inside the body when a spermatocele develops. Essentially, a blockage in the epididymal ducts leads to a build-up of fluid and dead sperm. This accumulation then forms a cyst-like sac, which we recognize as the spermatocele. The sac is typically located near the top of the testicle, but remains separate from the testicle itself. Spermatoceles are fairly common, particularly in men between the ages of 40 and 60. While they can occur at any age, they're less frequent in younger males. Although the exact prevalence is difficult to determine due to many cases being asymptomatic and unreported, they are estimated to affect a significant portion of the male population. Furthermore, they occur with similar frequency across different racial and ethnic groups. In many cases, a spermatocele causes no symptoms at all. The individual may be completely unaware of its presence. When symptoms do occur, they are typically mild. These can include a small, painless lump in the scrotum, usually located behind or above the testicle. There may be a feeling of heaviness or fullness in the affected testicle. In rare instances, discomfort or pain can develop if the spermatocele becomes particularly large. It's important to note that pain is generally not a primary symptom. Diagnosing a spermatocele usually involves a physical examination by a healthcare professional. During the exam, the doctor will palpate or feel the scrotum to identify any abnormal masses. To confirm the diagnosis and rule out other potential conditions, an ultrasound scan is often performed. Ultrasound uses sound waves to create an image of the scrotum, clearly visualizing the spermatocele and its location. In certain cases, transillumination, where light is shown through the scrotum, can also aid in diagnosis. A spermatocele will typically allow light to pass through, distinguishing it from solid masses. While spermatoceles can vary in size and presentation, there isn't a formal classification system based on types. They can be single or multiple, and they can range from barely detectable to quite noticeable. The important distinction lies in whether they are symptomatic or asymptomatic and whether they are causing any complications. In many instances, treatment is not necessary, especially if the spermatocele is small and asymptomatic. For those experiencing discomfort or pain, several options are available. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage mild discomfort. In some cases, a scrotal support or jockstrap can provide relief by reducing pressure and discomfort. If these conservative measures fail to provide adequate relief, surgical removal, known as a spermatocelectomy, may be considered. Alternatively, sclerotherapy, a procedure involving injecting a sclerosing agent into the spermatocele to shrink it, may be an option. However, sclerotherapy carries a risk of damaging the epididymis. Unfortunately, there's no definitive way to prevent a spermatocele. As the underlying causes are often unknown, targeted preventative measures are difficult to implement. However, practicing good testicular self-examination regularly can help detect any abnormalities early, allowing for prompt evaluation and management. The prognosis for spermatoceles is generally excellent. In most cases, they are benign and do not pose a significant threat to health or fertility. Even if surgery is required, the long-term outcomes are typically favorable. While surgery can potentially lead to complications such as epididymitis or impaired fertility, these are relatively rare. Research continues to explore the underlying mechanisms of spermatocele formation and to refine treatment options, aiming for less invasive and more effective management strategies. Scientists are also investigating the potential role of genetic factors and environmental exposures in the development of spermatoceles.